Art of Aging, Module 5. Section 1, the Aging Process. The digestive system. With age, metabolism slows, weight increases, inactivity increases, less nutrients are absorbed, livers may not break down fatty food or toxins. There are more medications needed. Incidence of disease is higher. Polyps occur more frequently. Heartburn occurs more frequently. How the digestive system works. The digestive system is sometimes referred to as our second brain. Digestion starts in the mouth, where teeth chop the food and saliva begins to break down the food as the tongue and muscles move the food into the pharynx. The food is then switched to the esophagus and then moved on to the stomach. The stomach is located in the abdominal cavity and is normally about the size of 2 fists side by side. The stomach acts as storage for food while it digests. The hydrochloric acid and digestive enzymes continue to digest the food. The food then passes to the small intestine, 10 feet long and 1 inch in diameter. The small intestine coils like a hose and has ridges and folds to maximize food digestion and absorb nutrients. When the food leaves the small intestine, 90% of the nutrients have been extracted. The liver's main job is the production of bile to secrete into the small intestine. The gallbladder stores and recycles excess bile from the small intestine so it can be used for the next meal. The pancreas secretes digestive enzymes into the small intestine to complete the digestion of foods. The large intestine is 2.5 inches in diameter and 5 feet long. The large intestine absorbs water and contains bacteria that help to break down the wastes to extract a small amount of nutrients. Feces exit the body through the anal canal. Steps for digestive health. Maintain healthy weight. Take care of gums and teeth for chewing. Maintain a healthy diet with smaller meals and smaller portions. Avoid excess alcohol. Increase alkalinity in diet with more plant foods. Increase fiber. Add omega-3s. Exercise daily. Check your medications. Drink at least 8 glasses of water daily. See your doctor regularly. Check food allergies and intolerance. The urinary system. With age, muscle weakness in women causing incontinence or urine retention occurs. Chronic inflammation of the prostate gland in men causing incontinence or urine retention occurs. There is a decrease in bladder size causing frequent urination. More common instances of urinary tract infections. More instances of chronic kidney disease. Less urine is produced. The major function of this system is the elimination of excess water, salts, and waste products. Although renal function declines substantially with age, it usually remains sufficient for removing bodily wastes. Nevertheless, reduced renal function decreases the elderly person's ability to respond to various physiological and pathological stresses. In general, aging is associated with an increased incidence of kidney problems. There is a decline in the number of nephrons by about 40 to 30% between the ages of 25 to 85. Nephrons are the basic functional units of the kidneys and are made up of renal corpuscle and renal tubules. There is also a reduction in filtration rate due to cumulative damage to the system and to reduction in blood flow to the kidneys. Urine is formed by the kidneys through three processes: filtration, reabsorption, and secretion. The ultimate source of urine is blood, and a large amount of blood is transported to the kidneys for filtration by way of renal arteries. Renal blood flow progressively decreases from 1,200 milliliters a minute at ages 30 to 40 years to 600 milliliters a minute at age 80. A decrease in the glomerular filtration rate, or the rate at which blood is forced through and filtered by the renal corpuscle in the kidneys, is the most important functional defect caused by aging. Since kidneys receive up to 25% of the resting cardiac output through the renal arteries, a large portion of total blood volume is filtered through the renal corpuscle each day. At this rate, it wouldn't take long to totally deplete the body's entire blood volume. Since this is obviously not a common problem, the body must have some way to recover a majority of that filtered blood. The process that returns necessary items from the filtrate back into the blood is called reabsorption. Reabsorption is responsible for returning 99% of filtrate back to the circulatory system. Reduced nephron sensitivity, which occurs with age, however, results in less reabsorption of water, so urination becomes more frequent while daily fluid requirements increase. At the same time, there is usually a loss of thirst, which compounds the problem. The muscles that help regulate the release of urine become weaker, which leads to problems with incontinence and often involves slow leakage of urine. This is usually a more common problem in women. In males, urinary retention might develop due to chronic inflammation of the prostate gland. Swelling of the gland prevents the flow of urine as it puts pressure on the urethra. Call your healthcare provider right away if you have any of the following: signs of a urinary tract infection, including fever or chills, burning when urinating, nausea and vomiting, extreme tiredness, hallucinations, or low back pain. Very dark urine or fresh blood in the urine. Trouble urinating. Urinating more often than usual. Sudden need to urinate or urinary urgency. Steps to urinary tract health. Drink a minimum of 8 glasses of water per day. Limit alcohol and coffee. Quit smoking. Avoid constipation. Exercise regularly. Watch your medications. Take your time and empty your bladder completely. Avoid infections by wiping front to back, urinating after sex, wearing cotton underwear and loose-fitting clothes, using the bathroom when needed. Eat a healthy diet. Maintain a healthy weight. Section 2. Habits and principles. Avoid toxins. Know the toxins. We grew up trusting my doctors, furniture stores, grocery stores, and yes, even restaurants. Now we find that our doctors have been taught to be reactive, not proactive. It's our job to be proactive. The pharmaceuticals we've been taking because we thought it was okay isn't. Furniture stores have been selling us fabrics that are causing cancer, damage to the heart, liver, central nervous system, and kidneys. Our grocery store and local restaurants have been selling us food that is addictive and causes all kinds of physical problems. What should that tell us? We have to be responsible for our own health. Are you toxic? Some symptoms of toxicity: headaches, depression, blemished skin, acid reflux, diarrhea or constipation, extra weight, cravings, fatigue, depression, trouble sleeping, inflammation. Foods. Aside from the obvious external factors like microwaves, chemicals in clothing, furniture, and cleaning supplies, the foods we eat are not really food. They are fake foods. Processed foods are made with food-like substances. Many of the fruits and vegetables we eat are grown with pesticides and heavily covered with poisons. The foods we purchase unknowingly in the store are genetically modified to look prettier, grow better, and last longer. The medicines our doctors prescribe have long-lasting, toxic consequences. Some toxins you ingest: sugar and sugar substitutes, gluten, caffeine, dairy, meat, processed foods, soda, nicotine. What potential dangerous chemicals can be found in the typical home? Potentially dangerous chemicals can be found in every room in your home. If not properly stored or used, these products could cause minor to serious, even life-threatening health problems for you or your children. What are these everyday household chemicals? Let's take a tour of the rooms of your home and discover what some of these chemicals are and what health harms they may cause. Keep in mind that most household cleaning products and pesticides are reasonably safe when used as directed, and that the level of toxicity of a product is dependent on the dose of the product used. Never use more than the amount listed on the label, and the length of exposure to the product. In the garage: antifreeze, ethylene glycol. The main hazardous ingredient of antifreeze is extremely poisonous. Through inhalation of fumes can cause dizziness. Swallowing antifreeze will cause damage to the heart, kidneys, and brain. Antifreeze can be fatal if swallowed. Safety tips: if you need to clean up antifreeze, the bright green or yellow liquid you find in your garage or driveway, make sure you wear gloves because ethylene glycol is absorbed through the skin. Also, keep your pets away from spilled antifreeze. Pets are attracted to antifreeze because of its sweet smell, but licking or drinking the fluid can kill your pet. A much safer alternative to ethylene glycol is propylene glycol. Before purchasing antifreeze, look at the label to identify products containing the less toxic chemical propylene glycol. Motor oil. Used oil or waste motor oil may be contaminated with magnesium, copper, zinc, and other heavy metals deposited from your vehicle's engine. Oil contains chemicals that can cause nerve and kidney damage, and that are also suspected of causing cancer. Latex paint. Unless ingested in large quantities, water-soluble latex paints are not highly toxic. However, some latex paints emit formaldehyde when drying. High levels of formaldehyde can give you a headache and irritate your eyes, nose, and throat. Oil-based paint. Oil-based paint contains organic solvents that can be irritating to the eyes and skin and can cause cracking of the skin. Inhaling paint fumes can result in headaches, nausea, dizziness, and fatigue. Most of these symptoms go away once you go out in the fresh air. However, frequent exposure to these chemicals in the presence of poor air circulation can cause kidney, liver, and blood problems. Safety tips. When painting, keep windows and doors fully open. Place a box fan in a window to keep direct air and fumes outside. Keep the fan on while painting and for 48 hours thereafter. Keep small children away from the room being painted and away from open paint cans. Batteries. Most wet cell batteries in use in today's cars, SUVs, and trucks are sealed, so you cannot be exposed to the battery's contents, which include sulfuric acid and lead. However, when activated, the electrolyte solution in the battery produces explosive gases that can be easily ignited. Batteries that contain sulfuric acid must so be labeled. Sulfuric acid fumes are strongly irritating, and contact can cause burning and charring of the skin, or blindness if you get it in your eyes. Lead is poisonous in all forms and accumulates in our body and in the environment. Safety tips. Never break the seal of wet cell batteries. If the seal is accidentally broken, keep children and pets away from the area until the battery's acid is cleaned up. Wash your hands after any contact with wet cell batteries. Windshield washer fluid. Common chemicals in windshield washer fluid are methanol, ethylene, glycol, isopropanol. Collectively, these products can irritate the lining of your nose, mouth, and throat, and can cause damage to the nervous system, liver, kidneys, heart, and brain. Ingestion can result in drowsiness, unconsciousness, and death. In the laundry room and the utility room. Laundry detergents. These products contain enzymes, as noted by the names cationic, anionic, or non-ionic on the label, to loosen stains and ground in dirt. Cationic detergents are the most toxic when taken internally. Ingestion can result in nausea, vomiting, shock, convulsions, and a coma. Non-ionic detergents are less toxic but can irritate skin and eyes and make you more sensitive to other chemicals. Asthma can develop if a person is exposed to large quantities of detergent. Detergents are also responsible for many household poisonings from accidental swallowing. All-purpose cleaners. There are numerous all-purpose cleaning products on the market. These products usually contain detergents, grease-cutting agents, solvents, and/or disinfectants. The specific chemicals in these ingredients include ammonia, ethylene glycol, monobutyl acetate, sodium hypochlorite, and trisodium phosphate. Depending on the ingredients used, all-purpose cleaners can irritate the skin, eyes, nose, and throat. They can be highly poisonous to both humans and animals if swallowed. Safety tips. When working with an all-purpose cleaner, always wear rubber gloves to protect your skin. Also, be sure there is good air circulation in the room. Open several windows or keep a fan running. Most importantly, never mix two cleaners of different kinds together, especially products containing ammonia and chlorine or bleach. This mixture can result in the production of a gas called chloramine, which can cause serious breathing problems and be potentially fatal if inhaled in great quantities. Bleach. Household bleach contains a chemical sodium hypochlorite in different concentrations ranging from from 0.7% to 5.25%. These percentages are the amount of the chemical in the liquid. The rest of the liquid is mostly water. Chlorine bleached liquid and vapors can irritate skin, eyes, nose, and throat. Dermatitis may result from direct skin contact. Ingestion can cause esophageal injury, stomach irritation, and prolonged nausea and vomiting. Never mix chlorine bleach with any other household cleaning products, and especially not with ammonia. Doing so can result in different types of poisonous gases being released, which can cause very serious breathing problems. Pet flea and tick treatments. Many of the pet flea and tick treatment products contain pesticides that consist chemicals that can cause headache, dizziness, twitching, and nausea. Safety tips. When using these products on your dog or cat, be sure not to pet them for at least 24 hours. If you forget and do pet them, wash your hands and skin immediately with a lot of soap and water. Insecticides. Insecticides contain some of the same pesticides found in pet flea and tick treatments. These chemicals can cause headache, dizziness, twitching, and nausea. Safety tips. When using an insecticide in the home, make sure it doesn't get on food or substances that come in contact with food, like dish towels, dishes, silverware, or countertops. Dishwashing detergents. The main ingredient in automatic and hand dishwashing detergents is phosphate. Automatic dishwashing detergents are known to produce skin irritations or burns and may be poisonous if swallowed. Hand dishwashing detergents are milder than automatic dishwashing detergents. If swallowed, they may cause irritation to the mouth and throat, nausea, but they are not fatal if swallowed. Oven cleaners. The basic ingredient in oven cleaners is lye. Lye is extremely corrosive and can burn your skin and eyes. It can cause severe tissue damage and may be fatal if swallowed. Safety tips. When working with oven cleaners, always wear an apron, gloves, and safety goggles. Do not breathe the fumes. Make sure the work area is well ventilated. The best tip: non-toxic oven cleaners without lye are available. Look at the label and select a product that does not contain lye. Antibacterial cleaner. Antibacterial cleaners usually contain water, a fragrance, a surfactant to break up dirt, and a pesticide. The pesticides commonly used in antibacterial cleaners are quaternary ammonium or phenolic chemicals. Antibacterial cleaners can irritate your eyes and burn your skin and throat. Safety tips. To help protect your skin when using these cleaners, wear latex dishwashing gloves. If you get some of the cleaner on your skin or in your eyes, wash it off immediately. Window and glass cleaner. The basic ingredients of window glass cleaners are ammonia and isopropanol. These products may be irritating to the eyes, skin, nose, and throat. If swallowed, they may cause drowsiness, unconsciousness, or death. Safety tips. Always wear gloves to use these products in use in well-ventilated areas. Bait traps for ants, cockroaches, crickets, or other insects. The insecticides commonly found in insect bait includes ivermectin, propoxur, triclophan, sulfonamide, chloropromus, and boric acid. Since most insect baits are enclosed in containers, it's unlikely that you'll come in contact with the pesticides within them. If you do, wash your hands with plenty of soap and water. In the bathroom. Toilet bowl cleaners. Toilet cleaners contain the chemicals sodium hypochlorite or hydrochloric acid or bleach. Most disinfectant cleaners are very irritating to your eyes and skin and will burn your throat. Never mix a toilet bowl cleaner with any other household or cleaning products. Doing so can result in poisonous gases being released and can cause very serious breathing problems. Safety tips. Always be certain when cleaning your bathrooms that the room has plenty of ventilation. Leave the door open and use the exhaust fan if you have one. Wear latex dishwashing gloves to help protect your skin from splashes when using toilet cleaners. If you splash some on your skin, wash it off immediately. Mold and mildew removers. Chlorine and alkyl ammonium chlorides are the common fungicide chemicals found in mold and mildew removers. Cleaners with mold and mildew removers may cause breathing problems and, if swallowed, can burn your throat. Safety tips. Wear latex dishwashing gloves to help protect your skin when using these products. If you get some on your skin, wash it off immediately. Drain cleaners. Lye and sulfuric acid are the main ingredients used to unclog drains. Lye can cause burns to the skin and eyes, and if swallowed, can damage the esophagus and stomach. Sulfuric acid can irritate the skin and eyes and can damage the kidneys, liver, and digestive tract. These chemicals produce dangerous fumes, can cause skin burns, and can cause blindness if they come in contact with your eyes. Drain cleaners can be fatal if swallowed. Safety tips. Always use protective gloves and wear goggles when using these products. Also, make sure there is good air circulation in the room where these cleaners are being used. In the living room. Rug, carpet, and upholstery cleaners. These cleaning products contain chemicals used in dry cleaning, naphthalene, ammonia hydroxide. The fumes given off by these products can cause cancer and liver damage and have been known to cause dizziness, sleepiness, nausea, loss of appetite, and disorientation. Safety tips. Use these products in well-ventilated areas and try not to breathe in the fumes. Furniture polish. Furniture cleaners for wood may contain petroleum distillates and oil of cedar. Furniture polish typically contains one or more of the following substances: ammonia, naphtha, nitrobenzene, petroleum distillates, or phenol. These chemicals may irritate your skin, eyes, throat, lungs, and windpipe. If swallowed, furniture polish can cause nausea and vomiting. Medical help should be sought. Air fresheners. Air fresheners contain formaldehyde, petroleum distillates, p-dichlorobenzene, and aerosol propellants. These chemicals are thought to cause cancer and brain damage. They are also a strong irritant to the eyes, skin, and throat. These ingredients are usually highly flammable. Additionally, solid fresheners usually cause death if eaten by people or pets. Safety tips. Do not spray air fresheners around an open flame. Use them only in well-ventilated areas. Baking soda, which is not toxic, can be used as an alternative to an air freshener. Household foggers. Like insecticide and pet flea and tick products, household foggers or bug bombs contain many of the same pesticide chemicals. Exposure to these chemicals could cause burning in your eyes or your skin, or can result in breathing problems. The contents of foggers can be flammable. Safety tips. Proper use of foggers require that all windows and doors to the specific room or entire house be closed. Therefore, all people and pets need to get out of the house, even if the specific room being bug bombed is closed off. The gas emitted from these foggers will seep under doors and through air vents. Toys, food, plates, cups, silverware, and cookware should not be left out anywhere. After the fogger is finished, clean all table and countertops before using them. The house or room also should be aired out. Turn on your air conditioner or open the windows. Use fans to help air out the house. In the bedroom, mothballs. The pesticides in mothballs are chemicals known as naphthalene and p-dichlorobenzene. Breathing the fumes from mothballs may cause headaches and dizziness and may irritate the skin, eyes, and throat. Extended exposure to the vapors may result in cataract formation and liver damage. In the backyard and tool shed, swimming pool chloride tablets. Disinfectants containing chlorine for use in swimming pools are the chemicals calcium and sodium hypochlorite. These chemicals are the same but in higher concentrate than those found in other household disinfectant cleaners because they will be diluted in a very large amount of water. Coming in contact with these chemicals before they are diluted cause breathing problems and a burning sensation to eyes and skin. If swallowed, the chemicals can burn the throat and could be fatal. Algicides for the pool. The chemicals in algicide for swimming pools commonly include alkyl ammonia chlorides. These chemicals can cause breathing problems. If swallowed, they can burn the throat. Insect repellents. The pesticides commonly found in repellents are pyrethrins and a chemical more commonly known as DEET. The chemicals in repellents may cause a burning sensation to eyes, skin, and throat. The chemicals also may cause anxiety, behavioral changes, mental confusion, and loss of coordination. Safety tips. If the label says that you can apply the repellent to skin or clothes, apply it only to your clothes. It will work just as well. Keep repellents away from the eyes and mouth and away from any cuts on the skin. Don't spit the repellent on your face. When you come indoors, take a bath to wash off the chemicals and launder your clothes. Weed killers. The common pesticides found in weed killers are diquat 2, 4 through D and glyphosate. Some weed killers can irritate the eyes and skin. Some of these chemicals can be very harmful if swallowed or inhaled or if large amounts get on the skin and are not immediately washed off. Baits for rodent control. The pesticide commonly found in baits is known as warfarin. This chemical causes internal bleeding if ingested in large amounts. Materials. In the bedroom. Did you know that our mattresses have more chemicals in it than a barrel of crude oil? Most mattresses are made of petrochemical derivatives, or glue. To add insult to injury, many have added fire retardant chemicals, toxic dyes, and sometimes even pesticides, herbicides, and fungicides. 1. Your mattress should be made of natural materials like cotton, wool, or organic materials. Then you need to be sure that the wool was sheared from sheep who were untreated. 2. Make sure the mattress and pad have no synthetic material, such as foams, glues, and chemicals. No moth-proofing or fire retardants. 3. The frame should be built without toxic glues, particle board, chemical stains, or paint. 4. It is important that your mattress does not support mold and mildew and can absorb and release moisture. 5. Use a tightly woven organic cotton barrier cloth that does not allow dust mites. 6. Launder bedding with unscented, non-chlorinated soap. When replacing carpeting, be sure to look for natural fibers. If you already have carpeting that is a few years old, the chemicals have probably already off-gassed. Carpet is associated with more and more health problems. Toxic chemicals are in the fiber bonding material, glue, dyes, backing glues, fire retardants, latex binders, fungicides, antimicrobial, antistatic, and stain-resistant treatments. These are all great advances we have been sold on all these years to offer us better use. It is all toxic. There are wallpapers now that are being manufactured responsibly. Mainstream wallpapers like York wall coverings have collections that are beautiful and safe. Vinyl wallpaper outgasses toxic fumes. The glues used to adhere wallpaper can be a problem, and water can be trapped behind the wallpaper and cause mold. There are many wall treatments available today that are safe and green. One such wall covering takes a mixture of natural fibers and minerals in a high-density composition that is troweled on the wall and provides acoustic benefits as well as safe ambiance. Paint is available in low VOC and no VOC alternatives. That strong and annoying odor of new paint is dangerous. You should stay out of the room until the smell is gone. There are a million choices for window coverings today. The fabrics for your window treatment should be natural, non-synthetic, and free from formaldehyde and flame retardant. Manufacturers have become more responsible in the materials used to make shades and blinds. The products that are safe will usually be certified. Here is a site that has a lot of great information. Check it out for answers to any questions you may have. www.greenguard.org/en/index.aspx. Check food allergies. Food allergy testing. Diagnosing food allergies. The first step a medical professional will take to diagnose a food allergy is through health history. The medical professional will ask questions to determine if a food allergy may be causing your symptoms and to identify the problem. The next step will be to test for allergies. These tests are all proven diagnostic methods. Depending on your medical history and initial test results, you may have to take more than one test before receiving your diagnosis. Important: you must eat the food you're testing within 48 hours of having the test. Symptoms typically appear within minutes to several hours after eating the food to which you are allergic. An allergic reaction to food can affect the skin, the gastrointestinal tract, the respiratory tract, and in most serious cases, the cardiovascular system. Reactions can range from mild to severe, including the potentially life-threatening condition anaphylaxis. Mild to moderate symptoms may include one or more of the following: hives, which are reddish, swollen, itchy areas on the skin; an eczema flare, a persistent dry, itchy rash; redness of the skin, particularly around the mouth or eyes; itchy mouth or ear canal; nausea or vomiting; diarrhea; stomach pain; nasal congestion or a runny nose; sneezing; slight dry cough; odd taste in mouth. Severe symptoms may include one or more of the following: swelling of the lips, tongue, and/or throat that blocks breathing; trouble swallowing; shortness of breath or wheezing; turning blue; a drop in blood pressure; feeling faint, confused, weak, or passing out; loss of consciousness; chest pain; a weak or thready pulse; a sense of impending doom. Severe symptoms, alone or combined with milder symptoms, may be signs of life-threatening anaphylaxis. This requires immediate treatment. Health risks of untreated food intolerance. There are serious health risks associated with untreated food intolerance. If left unattended, chronic symptoms can develop into chronic disease. Illnesses associated with food intolerance and allergy. Anemia. Autoimmune conditions such as rheumatoid arthritis, diabetes type 1, Graves' disease, Crohn's disease, and others. Behavioral problems in children, bowel cancer, celiac disease, depression, obesity and metabolism issues, diabetes type 2, heart disease, atherosclerosis, hyperthyroidism, infertility, learning difficulties, malnutrition from poor absorption of nutrients, miscarriage and difficulty conceiving, neurological conditions such as multiple sclerosis, motor neuron disease, epilepsy, and memory loss, osteoporosis, and bone density loss, psychological disorders such as depression and behavioral difficulties, rheumatoid arthritis, ulcerative colitis, and others. Goal settings, steps, goals, and journal. The more control you have over a goal, the better chance you have of attaining it. If you set the goal by performance of the action rather than the outcome, you will be happier. For example, you might set a goal to finish a 5K, which is performance-based, rather than to score in the top 10 at the 5K, which is outcome-based. There are several steps in goal setting. 1. Become aware of the need. 2. Envision the outcome. 3. Set the intention. 4. Focus on the goal. 5. Take action to achieve the goal. 6. Have faith that if you set the intention, focus, and take action, you will reach your goal or the best outcome. Now take a moment to fill out your goal-setting sheets. Section 3. The Truth. Susan Gervasi, Health Coach. I would love to hear messages that growing older is not synonymous with inevitable and irreversible chronic illness. Messages early on when they took our family history of diabetes, heart disease, dementia, and issues in overall aging meant inevitable decline. Enjoy it while it lasts. Images in media showed older people in recliners sitting on front porches, not doing anything of importance or purposeful moment. The glorification of youthful looking. We have enjoyed spending this time with you. Thank you.